Y'all got me fired up. We have roughly an hour and a half before we have to start doing the things you got to do to end the meeting, to do some stuff. And I'll tell you what I'm hearing. I'm hearing that we may have sort of a North Star, at least an initial one, around the littles. Like, how do we make sure that they don't live in poverty, that they can grow, that we all can thrive, right? Like that's a piece of what may be at the centering of what we're trying to do in an equitable manner. I'm also, though, hearing from Willa some requests. Willa is like, we're out here trying to do some stuff and we need help. I mean, similarly, whether it's the littles or it's the seniors in our communities and families, like people are in need. And there are folks who are out here trying to meet those needs. And the sort of a lack of the infrastructure for movements is getting in the way. So one of the requests was around like a place to hold and sustain the work. Like that was a request. It's like, can you help with that? So I think part of where we're going to be over the course of the next hour and a half is answering that question. Can we help with that? Like when I ask the question, how do we work together differently? The first piece of that equation is, who's we? Is it the we in this room? Is it the we that includes the people online? Is it the we, the folks who are back at home? Is it the we that includes the people in the margins? Like, who is your we? So when you make, if you have a request, hey, here's some stuff that would be helpful to organize this work, or maybe you have an offer. Yeah, that's a thing I can do. Or maybe it's an offer that hasn't even heard a request yet. Like, but I'd ask you to think about it in the context of who's the we that you're looking to engage when you walk out of this room. Who's the we you want to engage with? Like with whom when you walk out of this room? Who's the we? So there's a collective piece of this equation. Has to do with there's people who gathered and online and here. There's a roundtable piece of this equation, a piece of infrastructure and structure that actually exists, that does exist already. And then there's the structures and the stuff that you already do and all the places that you're in. And I can imagine that some of the dissonance is trying to sort through those differences. And for the purpose of today, over the course of the next hour and a half or so, I'm hoping we can get at some of those offers, some of those requests, for the purpose of organizing ourselves in a way that we can build the infrastructure, like the elements necessary for a movement. The opportunity exists. We know we need infrastructure. We know we need narrative. What we don't have is like an organizing force in order to galvanize those things in a cohesive manner. So what are the offers and requests that people may have in order to make that go? Does that seem like a reasonable way to focus our attention? Yeah. Shoma did you have a hand up? Sure, you can start with general offers. Yeah. I wasn't doing that yet, but why don't we do that right now? That sounds like a wonderful thing. No. Good.
I sit in a lot of these conversations, and I know many of you do too. I think one thing that would be really helpful for us is to bridge these conversations and in ways that are relevant to the particular groups and the specific pieces that people are working through. So there are some people that are organizing around what's a deeper systemic change that addresses root causes of racial justice, economic inequity, and in addressing the core measures, data, like all of the movement infrastructure, narrative change, and shift in contract around that. And a lot of those folks are organized around the Wellbeing in the Nation network. And there's a potential health equity hub that's forming there for groups that include communities and others that are trying to address structural racism, et cetera. I'd love to think about how this group could serve as air cover for that group, bringing the thought pieces, the evidence, the writing that really helps those groups that are trying to do that work, and the support systems that are needed for that. There's another group that is made up of health funders that are thinking about how they contribute to moving the needle. That's a different kind of group to engage with. And then there are other groups that are just focused on, for example, Rise to Health, which is an IHI initiative that's along with the AMA working to advance racial justice. So I guess my main point is, here are all these things that are happening, and I've named like 3 out of like 20 that I am in different tables around. How might we, instead of maybe creating another group, think about mapping where things are and where this group could contribute and connect in a way that builds the strength of the field?
And when you say, how can this group, do you mean how can the roundtable?
The people, I'll just say the roundtable and the people
who
have
are
come here
engaged
who
in
would
this
like to be engaging in that.
Okay.
And my offer might be that I can help put together what some of those opportunities are, and create a Google Doc or something where others can do that. And then the other offer I'll say is for those who are really interested in the more systemic change. Some people are getting together in April, and I'm happy to tell you more about that if that's.
So in order to be engaged in this as best as we can, we're going to capture some of those notes. Susan's going to, right now she's in the back of the room doing a thing, but we're going to help capture some of the notes. I know that this is being recorded. So we'll capture the offers. And in a moment, not in this moment, we're also going to create an opportunity. I see your hand, Alina. In a moment, we're also going to create an opportunity to write down some of those offers and requests, so we can sort of see some of them emerging in real time. Okay, we're not going to do a sticky dot process, but we are going to make sure we're capturing some of the things that people are saying. Alina has a thing to say. Yep, it's on.
So I just wanted to say a few words about the roundtable, just to make sure that everybody's sort of clear about the roundtable's sort of work and composition and so on. The Roundtable on Population Health Improvement is one of the convening activities at the National Academies. It's a stable group of about half of members who are appointed for their expertise, some academics, some from various types of organizations, et cetera. And about half of the members are sponsoring members of the roundtable, who bring, of course, expertise, but also represent an organization that is providing resources for the roundtable to operate and hold for events each year like this that are public facing and so on. The roundtable itself cannot make consensus recommendations, because it's not like one of the consensus committees at the academies that is carefully composed with attention to bias and conflicts of interest and that sort of thing. But the roundtable can really serve as a meeting place, can serve as an amplifier, can serve as a platform for moving forward ideas, bringing people together, et cetera. So I just wanted to make sure that everyone was clear about that. And the roundtable itself is about, a group of about 25 people, led by Ray Baxter, who's here in the room, and Ana Diaz-Ru, who's not with us today. And the roundtable webpage, I think has been mentioned before, is nas.edu/pophealthrt. So if anyone is interested in other work we've done, et cetera, please take a look, reach out. Thank you.
So I think the question that I would have based on that, Alina, is part of what I think I'm hearing trying to develop is who's the we in order to make some things happen. And so given the way, you may still, someone else can answer this question. It doesn't have to be Alina. I'm going to put Ray on the spot. Here you go, Ray. That's what you get for opening the meeting yesterday. And so as we think about whatever we collectively want to do, this group isn't necessarily tasking the roundtable with things. However, if people say we would like to work together in order to help make something happen, again, we've talked about the elements that make up movements. Like, what do you have ideas or suggestions about how the roundtable plays in that? I mean, this was, I thought Shoma made a wonderful offer. Like, here's some things we can do. Here's a role she's willing to play. And then like, how do we organize ourselves in order to do that? Given the way the roundtable is structured, is that a thing that Shoma sets up a email list and she manages that individually? Like, how do we think about what we do collectively coming out of this? And again, being really clear about what the roundtable can and can't do, or will or won't do, or wants to consider or not. And it can help us get clearer about the roles other people can play. And I'm putting you on the spot not to answer the question so much as to respond and maybe even invite some other people into the conversation. Watch this. I'm still going to give him another microphone. I got 4 of these.
They get off the hook. So I have a question to ask Alina. Is Alina still in here? So Alina, I know the round table, or maybe it's the National Academies, has a function of collaboratives. And so right now the round table has a business group that's a collaborative, and you have a healthcare expenditure collaborative. It's kind of a holding place that brings people together who are interested in a purpose. So is that something, if Shoma helped to kind of bring the people together who might want to do, quote, a collaborative on a what? Maybe it's Martha came up with Decade of the Children, or it's, the children of Jennifer, the children of James, the children, is that something, or is that too big and amorphous?
So I think, I do want to hear what Ray has to say, and of course what Shoma has to say to this. So the roundtable collaboratives are sort of like, under the auspices of the roundtable, and they're just a bunch of people who are interested in a particular topic, talking about, writing articles, doing various things, but they're relatively small, couple dozen people in conversation. What Shoma and her colleagues are, supporting is a network of networks, and really sort of a massive kind of movement, mycelial network, I guess it sort of is. So I think we can plug in, we can connect in various ways that become obvious. So I think there are things that we can do under the roundtable, but we can't be I don't think we could be the envelope for a concerted effort to move this forward, but we can connect with others to develop an envelope or to plug into an envelope, if that makes sense.
Yeah, go ahead, Ray.
I deferred to Alina because she actually knows what the roundtable is and can and can't do. And others of us aren't fettered by that quite as much, but we're aware of it. And I deferred to Sandy because she's a previous chair and a very successful and influential one. So she went exactly where I was going to go, which is the notion of the collaboratives in which the roundtable links in, or a part of the roundtable, with other organizations or other networks that have capabilities that we don't have, or don't have constraints that the roundtable does have. That said, I think there is another feature to the roundtable, and that is the collective and individual influence and networks of the people who sit on it. And that is, to me, in many ways, the real asset of the roundtable. There's an asset that we sit in the National Academies, which sounds really important, but actually gives us a voice that may be out of proportion to who we are or what we bring to bear, but we don't always use that as much as it could be used. So there's the voice, and then there's the networks and relationships of the people, and it's very people-centered, and we don't intentionally often harness that as for influence. And I do believe there is potential to do that. I'm pretty practical, so I go to where, what do we actually have? Who are we? As opposed to what would we like to be, or what did we wish we be, or what did we wish we had done long ago? And that set of relationships and networks to me offers a potential to help mobilize, educate and mobilize people in the fields that we are in. Most of us are not, this is a personal view, in the movement field, or not anymore. Most of us are not. Some of us are economists, but tend to be health economists, not people working in labor economics or in other dimensions of it. We don't bring a lot of the expertise that the vision and North Star we've been talking about today requires, and our networks don't always connect with all the lateral up and down connections that are needed to do that fully. But the ones we do have and the expertise we do collectively have are important. So I think there's opportunity to reach the people and organizations and voices we do know and touch already, both in our work at home and in our work here together, that could be mobilized in a way to help here. So that's both kind of a personal reflection on it,
Yeah, that's great.
and a more institutional view.
So Alina wants to say something, and then Rick wants to say something, then we're going to go to Brian.
So just a quick point that I was going to put, or I don't know, on an underscore on what Ray said, is to add that there will be a few products coming out of the event. One is going to be obviously the recording that's going to be archived on the webpage so people could watch it. There will be written products too. So my colleague Asia and I will be working on both a brief proceedings coming out of this, and I'll also work on a longer one. And one of them will be sort of a scrolling product on the website with bits of video and pullouts of quotes and so on. So if the group here, as a part of this conversation, wants to come up with lists of ideas, like let's say you take young people or children as the North Star, and you want to say, here's a set of 5 policies that should be considered. Here's a set of 5 components of infrastructure that need to be developed or don't yet exist or need to be expanded on, or whatever. If people are interested in doing those sorts of things, this could become part of the record of this event. The idea is that, again, they can't be, consensus recommendations, because you all are not looking through the literature and figuring out where the evidence base is on these particular things, but drawing on your collective knowledge and expertise to essentially crowdsource a list of, possible things to keep in mind, the list of, key bullet points that will go in the products that come out of this and could be used as, by people as resources to help, build some kind of path forward. Thank you.
All right, thanks. So I see some hands. Yeah, you can go ahead and hand that to Tyler.
Oh, yeah.
Yeah, no, well, you'll be third, but you can hold the mic. Okay, so Rick and then Veronica.
Okay, thanks. An offer and a request. So Rick Brush with Wellville. Wellville's a 10-year project working with 5 communities around the country. These are communities that have been at it for a long time. We've been supporting them for about 8 years, so we have a lot of on-the-ground insights about what's working, what's not. About a year ago, Wellville realized that much of what our communities are bumping up against are national culture, funding, policies that they feel powerless to change. So we said, well, we need to find partners that we can align with who can shift these larger dynamics. And so we wrote a little bit of paper that sort of speaks to this opportunity to align and to work together nationally. Came up with a list of about 33 and counting multi-site national initiatives that are working with collectively like thousands of communities, millions of people, billions of dollars being invested. Are not all very well connected, but they're like purpose-built communities and invest health and build health challenge. So the offer is that we've been thinking about this a little bit. We've identified these like 6 areas of potential national change. Narrative is one, funding, policy change, learning, which speaks to sort of research and evaluation. So we are very interested in doing this. We cannot do it alone. And so we've been talking to folks like Shoma, who runs the Wellbeing in the Nation Network. So the request is that Wellville needs to fit into this larger network. Shoma, I'm teeing you up if you want to make that offer again, to bring our 5 communities, 5 small but mighty communities, and align with these other thousands of communities to drive this national change. And if anyone wants this sort of paper and wants to add to our list of 33, please reach out to me, rick@wellville.net. Sorry for the plug, but I'm happy to share what we've been thinking about and invite you into adding your communities and networks into the mix as well.
Awesome. Great. Thanks, Rick. Veronica.
Yes, Veronica Bella. One of the things that has struck me was the conversation that I had with Terry and Dr. T when I first arrived yesterday. And they started talking about things that they were actively doing that have worked to shift investments to create a more equitable future. I am a practitioner by training. I did go to school and get my doctorate, but I am very driven and action oriented. And so one of the things that I feel like I'm struggling with in this room is there's such a wealth of knowledge about what works. And we keep talking about like what we need to do. And I'm like, hello, like the knowledge is here. We need a way to come together, right? So that we can share best practices. We can share like, here are things that I've tried and have actually been successful. Here are things that I've failed. Here are the elements of partnerships and why they've worked and how we've made the cases. And so for myself as a practitioner, I want to know what are those things that you guys have already tried. And I, of course, have some myself. And like, let's have that conversation and continue to have that conversation so we're not isolated and doing it alone and figuring it out with a new group of people each time. Like we should be helping and building each other. And so I really loved what you said about figuring out what are the assets that are already existing that are working on some of these things. Like how are we already framing it? And like, let's move that forward and start to work on that as opposed to like, and I think the other thing is like, there are like things that people are already working on. And I think if we figure out where we want to be, we can define what are the institutional resources like the roundtable, like how can they help? But I'm struggling with the conversation of like, we have a resource, but not where we're trying to go. And I think it's like, I want to get to where we're going and what are the functions that we need to build as a community.
Great, thank you. So I want to check online. And then I'm going to come to Tyler and then, yeah.
So I know Rochelle, you've had something you wanted to bring into the room a bit, and Bobby after Rochelle, and then if there's anybody else online that has something they want to contribute.
Thank you. Can you hear me all right?
We certainly can.
Awesome. So I've been incubating this idea for a while, but what we really need is boots on the ground. We need to reduce the gap between the people in power and the people with lived experience. So the best way I've found for that is to utilize existing sites, but it would be awesome if we could create our own unique social network site type of consolidated service center where people can share data and resources along with gather more and identify gaps in service. There are currently limited versions of this like benefits.com, findhelp.org, and yourtexasbenefits.com, but they don't really allow as much for people to input their own experience and requests on how to improve services. I think if we could actually come together and create a consolidated point where we can come together and share this information, make it more accessible to people, and then be able to share that to the actual on the ground physical community centers and people in the community to empower them with that information and with those resources, that would make the biggest difference.
Thanks, Rochelle.
Yeah.
There's been a lot of talk online about these very pragmatic ways to think about sort of translating between scales. And so thanks, Rochelle, for continuing to emphasize that. And Bobby?
Hi, friends. It's been a treat to listen to this remotely and to feel very present with all of you. I think I want to pick up from one of the points that Ray made about, for me, I'll say one of the finest things about this roundtable is it's sort of multi-scale infrastructure, right? And we do a handful of things together like these joint events, but also the distributed action that is possible with organizations that do not cover every space in this movement, but cover many important spaces. And the thing that I love about that distributed infrastructure is also the thing that's most frustrating, is that we can get very disoriented frequently. And so this conversation the last 2 days has been helpful for me in pointing to that 99% of the effort on, are we building the will and the capability to act on areas that are important to act on, and who's the we? It's very, very hard to have sense-making, informed discussions, or even inspired investments in action without being able to have the infrastructure in place to be able to know where is the will in place, where is it not, and among who among those thousands of change makers is already making decisive moves forward, and where is there utter inaction where we could think we're going to have to get a lot more creative, a lot more committed, a lot more present to make changes that are within our reach. And so it's the infrastructure. The panel at the beginning of the morning described the underlying structure of really successful movements are always about opportunity and infrastructure and message. And it's the infrastructure that I see most conspicuous here. We have a lot of very effective messages, and I think we have immense opportunity. The infrastructure for this work seems very, very fragile and weak. And so that's the part that I would hope we can start saying, how do we take all these assets at the roundtable and our members and those adjacent initiatives that Rick talked about and that Choman talked about and that all of us probably could name, but we're doing it like without the playing at the scale that I think this movement deserves. And so that's my curiosity, is can we think together, and that listing that Alina asked, what are those things that would build the shared infrastructure for shared action learning in this growing movement?
Great. Thank you. I see another hand, so we'll go Tyler.
It's okay. I have an offer when you're ready, but if others want to speak first, James, go for it.
Okay, great.
Hi, thanks very much. I'm Meg Guerin-Calvert, head of the Center for Healthcare Economics and Policy. I wanted to follow up on Ray's comments. I'm co-chair of the Action Collaborative to this roundtable on business engagement for improving healthy communities. And one of our roles is to take away from this workshop and each workshop as to how might we as the collaborative, with our conversations, with our agenda for the year, with webinars, really further the networking, the best practices, the activities. What has resonated with me most is we spent most of 2020 and 2021 hosting webinars of communities and collaboratives that were really engaged around dealing with disparate mortality from COVID. Terry Williams, who's in this room from Atrium Health, he and his colleagues put on an incredible webinar on how it is that they had masked the city in Winston-Salem, very much focused on where and how were those trusted relationships built. So I welcome these ideas, feel free to email or we can talk. But what we'll do in the collaborative is to try to take away and see, we're already following up on the December workshop on anchor institutions, networks that focus on economic equity as well as health equity focused on specific communities and zip codes. So I'm thrilled at this conversation and the call for pragmatic as well as inspiration.
Great, thank you.
So I'm sitting in this space between like reflection and pragmatic and wanting to take action at the same time. Maybe we're all in a space like that. And my thoughts are a little scattered, so bear with me. But, I'm really sitting with Willa online for a moment. It resonates, I think, so deeply with me personally as somebody in a sandwich generation that is, has taken care of little ones and paying childcare while I was also trying to, take care of my mom who was really sick. And I think one of the things that the health field in particular can do, when we talk about generational well-being, we take a very broad view of that. I do understand, why children, because they're so cute, and we all love them, and why they are a motivator. And certainly, we want Corbin, Jennifer's son, to, have a rich, full, and healthy life. We want that for all of our children. But when I think about the investments I needed to make in my mom and how that drew away from what I could do for my daughter and my son, my grandma or her grandma having well-being meant that we had well-being and she had well-being. So I would like us to take a broad view of what it means to have generational well-being and not just have that be kids. And second, James, you asked the question of what will we do differently? And I think that there's so many themes in this room, and I just want to build again on a number of people have said it. Solutions exist in every community in this country. And we're not tapping into it enough. So, and last night we had a great conversation with James around, where do these investments go? I'm sorry, Jason, I'm so sorry. So, clearly organizing and building up the capacity of people in communities who have been historically excluded from these conversations is a necessary investment so that the next meeting like this actually has way more people that are boots on the ground, as Jennifer said, and maybe fewer of us, or maybe just way more of them and more of us, right? So how do we, because I always worry about, as we talk about community engagement, that's great when we have the money to engage, but we're not building the capacity of community to engage with us, right? So organizing on that side. The other thing is we always think about our work. For most of my life, I feel like I've been pushing things through these bureaucracies, right? Either through advocacy or now I'm like, maybe I don't even know, mid-level management, whatever I am, like pushing through. When you have the pull from leaders, that push becomes, there's this, the gravitational pull starts to go away from the status quo. So all of us have a role to play in developing and challenging our leaders, in how we create the pull. Because while I have a lot of influence and I do have some power, I don't have the ultimate power of voting or being a governor where I get to make decisions for the state. I have to work with them to convince them that what we're doing is the right thing to do. But probably all of us in this room have people that we can talk to create that pull. And then beyond that, once we have that organizing, I've heard a lot of talk about research and data. Building community-led definitions of well-being and the outcomes associated with that should be our North Star. And I'm not sure we've done enough of that work. It's another area for investment. And then finally, when you have that data and the organizing and you allow people represented by that data to tell their own stories, that's the core of your narrative. And how do we then participate in that and support people who have not had a voice in shaping how we move forward? So to me, like these investments seem they're obvious and they've all been generated in what everyone is saying. But if we don't build the capacity on the community side, then we'll keep having meetings where they're not present and we're talking about what should we do.
We're gonna go Tyler and then Sean.
So offers are okay at this juncture?
We're gonna accept offers whenever they are given.
Okay. So this is in the context of Ray, you describing the roundtable, and Alina, what you were describing. And I'd like to make an offer, but maybe it starts to model what other offers can look like from the room. So just alongside others. In the beginning, I was really talking more about the why than the what. And I think, Jennifer, if it's okay for us to accept in an archetypal way your son as our why, or young James, we know why we're here. And I want to respect that there may be different perspectives here. And to your point of our children, I think they are pretty close to it if they're not, what the arc of potentiation really looks like. So Bobby has brought us a reminder about there's a lot of ways to act. And in my world, they sort of relate to organizational practice changes that we can do in our organizational settings, public policies using our democracy, and ways of moving capital, public and private capital. So just practices, policy, and health, therefore health in all practices, policies, and investments as a way to think about it. And those are what's, and there's a lot of them. And I like to actually string them together because in a way, it's helpful when they are all acting at one time. It's the whole premise behind anchor institution or dose is that you do multiple things that are strong at the same time, policy, practice, and investments. Because in my philanthropic roles, I've been wanting to be a good student of movements. I've been very deliberate, particularly in the mental health and well-being movement, about how we made investments to build organizations. And in this moment, the biggest challenge that I've seen, the part of the movement that I feel related to, but I feel like it's really challenging, came up yesterday, which is the wrong pocket problem. How do you get the money, which typically gets saved in preventable utilization in the care delivery system or in the social services system or in the criminal justice system, where when things aren't working out, that's where the money gets spent. How do you get that money up front to a year before birth? And that's why I'm doing the work with the Federal Reserve Bank of New York. And there are others in the National Academies of Medicine, others who are, because they are looking at whatever you might say about the central banks, right? They've been part of financing the challenge. Financing part of what doesn't work. But they're very interested right now in how to repair that. And so part of that conversation is not only how do health systems step up as anchor institutions with all the resources, but how does that partner with community development finance institutions and the banks to bring the money up front so that we have what we need to invest in up front and begin to capture that gain along the way and through financing the avoidable costs later. Just like if we were all on city council and we wanted to put a new parking lot in and we didn't have the cash, we'd get a bond, right? And we'd pay that back over time as people use that lot. That's what banks do, is finance. So I'd like to invite folks into the thinking process on how we address this wrong pocket problem, what kinds of policies, practices, and investments we ought to put in place so that we can have the cash that we need to make those upstream investments in an arc of potentiation.
So I think I'm hearing the offer as an invitation to work with you in the role that you play.
And others, correct, who are in that environment?
Yeah,
yes.
You and others.
Yes.
You would sort of be the node in order to help make that happen. So it's an offer that's not specifically a roundtable offer, right? It's back to, I think what Ray said,
Yes.
like we have these networks
Yes.
that can make change. And so this is an offer to plug into through this method into one of the networks that are able to make that change happen.
Beautifully said. And if the roundtable wants to join, terrific.
Great. Yeah. Okay. So I see other hands. I want to make it super clear. You all are having a great conversation, in my opinion. We were going to have you talk in small groups, but you're not doing that. You're talking in a large group. And so right now, that's what we're going to do is keep talking in a large group unless and until it becomes clear that we need to stop doing it and go into the smaller groups. But we're reaching a point at which we won't have time to do the small groups. So this is a bit of a process check, which means that the people who haven't had a chance to speak, we want to make sure, like, if there's something you would like to say and you haven't had a chance to say it, or there's some people who've spoken more often, like, one of the benefits of the small group is everybody gets a chance to say some stuff. So I don't want to miss the voices of the people who tend not to raise their hand. So maybe you don't want to raise your hand. You can just kind of look at me like one of those, like one of these, and or raise a hand online. Like, we want to make sure we're hearing from the voices in the space. So Fisher, if there's stuff coming, let me know. I saw you're waiting. We saw, yeah, okay, all right. So we have a couple of responses to Tyler's comment. We're gonna start with Mac. We're gonna come back over to Jane. Then we'll go to Martha. Hillary, we got a lot to do.
I'd say,
yeah, okay.
just to add on to Tyler's piece, I've been working on that area for a while myself, and it's intellectually is so interesting to me, and it's so important because that is how we can pay for a lot of these things. I find it really hard though, because I feel like I lose the North Star when I end up doing that, and this is what I do, right? Because my North Star is not the saving of the dollars. So to me, it's almost like a how, right? How can we do this? Is we can solve the wrong pocket problem, but why did we do it? Was not to solve the wrong pocket problem. It wasn't to save or make 8 cents or whatever. So what I would love is if we could get some of the messaging help in that group. And like, I'm definitely in, Tyler, and I'm there. But if you're like, well, I don't really want to go save money, I'm in it for the messaging. We need that it'd be so helpful. Because otherwise it comes off as a little crass when I just put out my, like, here's the ROI.
That's probably shouldn't say it that way, Mac. Just throwing that out there. I'm kidding. I jest. I'm sorry.
So this is a comment building on what Tyler shared and also getting into the how a little bit. As we think about really ramping up the infrastructure for building this movement, I think it's critical to also be thinking at the same time how we are measuring its progress, because we know when we measure things, they tend to get done, or hopefully. So thinking about the extent to which narrative change is actually taking hold across the country, thinking about the extent to which we are building capacity effectively for many people to engage and participate authentically in these conversations. How effectively are we actually learning together and building bridges across many initiatives and efforts locally and nationally? And I think if we think about layering the priorities for measurement around infrastructure in a way that is hooked to the many outcomes and measures that are commonly known and that we pay close attention to, it can help us to more effectively build that infrastructure. That's definitely something that at the Ripple Foundation and Rethink Health, we're thinking a lot about alongside colleagues at WIN and others.
All right, I am cooking up a set of thoughts to share. Shoma, you ready to go?
Berwick recently wrote an article in JAMA in which he told us to be noisier about the greed in healthcare. And Jennifer just reminded us about a community in which greed is seen as a crime. Tyler, has your group thought about how we as a country begin to be noisier about that greed is a crime, it's taking resources away, and how could we galvanize around that?
Very briefly, yes. And Don agreed last night to kick off the conversation based on what he did with Salve Lucrum.
Great. Asked and answered. Can you pass that microphone over to Robert? Shoma, you ready?
Sure.
And then Hillary.
I mostly just didn't want to interfere with the flow of the conversation based on Tyler's comment. I wanted to say a little bit about what is already underway with the Wellbeing in the Nation Network and other pieces, which I feel like is going from being a network to more like an ecosystem, like wine, maybe. I don't know. I'm teasing about the acronym or any branding about that. But a few years ago, a group of people that said we need to make this kind of shift decided to be in a unshared journey together and said, what would it look like for us to create the conditions for more people to thrive, for everyone to be thriving and fewer people to be struggling and suffering? And then we built together with communities, shared assets like vital conditions and others. And because we chose to do it in a way that was connected, this stuff went and moved in all kinds of directions. Together with communities, we have a process of continually shifting based on community voice, the measures that matter for how we define equitable well-being and racial justice and intergenerational well-being across the entire span. And so some of what's already there, but with fledgling infrastructure and not enough people to take shared leadership in it. So that's the ask, is pieces that are about groups that are thinking about how to move the money, people who are thinking about how to shape and shift the narrative, people who are well organized around the data and have already begun to develop things like what are policies that could create shift. And it's all fledgling, as Bobby said, it's all like operating on a shoestring because it's discretionary supports. So I say that as both an ask and an offer. The offer is there's actually a lot that's already there, organized and underway in a way that's truly grassroots to grass tops, meaning that you have both significant presence of community members and leaders, including those who experience inequities, and all the way to people leading federal agencies, often in the same room, having a conversation together about how the world ought to be and what could we actually do, and then doing it in real communities. And I think that's the bigger piece of it, is how do we do that? So the good news is there's some infrastructure there and some organization there that could help us. There are groups like Community Commons and others where we can put those bright spots so anyone can find them. And there are amplifier narrative tools and things like the Win Digest and things that helps connect us and build a shared view together. I'm not actually saying this to say everyone needs to just join the WIN network and that's it. That's not, I mean, sure, that'd be great, but that's not really what I'm saying. I'm saying we need to invest in these kinds of shared connected ecosystems together. So when I think about where our investments need to shift, our investments need to shift in a way that those who experience the greatest inequities have the agency to define their own lives and are not experiencing inequities. Like, it would be amazing if that category didn't have to exist in a round of conversations. I think that's unlikely from a generational change perspective, but I'd love to see us working toward what that looks like. But the other place I think investments need to go is in building the infrastructure for a shared movement. And that can be co-investment that we all make together. And I think what Rethink Health and Wellville and community initiatives and We in the World and Wellbeing Trust and others have done is say, what could we do together that we couldn't do alone, with a level of seriousness that means that we actually connect and multiply efforts together. And we have more that we can do in that. I just can imagine a vision where we can do that. And where everyone has a role to play and distributed leadership in making that happen. And so that's where I love the idea, Ray, of a business collaborative, or Tyler, the conversation you convene. What I don't want is for that conversation and the outcomes of that not to spread as widely as it needs to, or have the depth of input that it might from communities. Yeah. And I'd love to see other parts of what's happening, for example, as 10,000 Black artists activists define and convene a conversation about what it would take to keep Black love alive, for their ideas and views to be a place. So the final piece of this is the gathering that's happening. If this group wants, we could create a space for a truly diverse set of people to continue that conversation on April 27th. But the entire gathering is April 24th to the 28th. And we can offer, Alina, would you be willing to share the link out to everybody as part of the materials? Thank you.
Great, thanks.
So picking up from a earlier conversation about what the roundtable, what the roundtable is good for and can do. And one of the things that you heard Ray and Alina say is in essence is that the roundtable can shine a light on things. The roundtable has a platform and a megaphone and can shine light on things. And so a lot of what we've been doing over yesterday and this morning is highlight things that that are important to shine a light on. And Shoma just did that explicitly. And so I want to welcome people both in the chat and in their comments to continue to share things that need a light or that would benefit, that we would all benefit from having a light shown on them, because that's a thing that will help the roundtable use its platform and its megaphone and the power that it has through those effectively. So that's sort of a request to those participating. Show us what we need to shine a light on. And then I'm also, as I said in my earlier comment, I'm really paying attention to what needs to be woven, what needs to be powered. And again, Shoma just highlighted something, but show us those things, each other, because there's people here who touch on a lot of different things that could help do more weaving potentially. What needs to be woven, what needs to be powered.
So I'm noodling. Oh, Robert, I forgot about you, Robert. No, that is not, it is not fine. Thank you for your grace. And
Oh.
yes, please go ahead, Robert.
Yeah, and you know, I hate to respond to the grace with being a cranky curmudgeon. So, so I just want to make 3 quick comments, just as an observer who's dropped in. So one is that we're making the assumption that we have the answers to some fairly complicated problems, and that I'm not sure that we do. I do think that we need to dig deeper into what really has worked, and that we have to go beyond case examples, because that these are problems like structural racism and others that have been very, very resistant to a variety of interventions. The second issue is this issue of, do we have the right people in the room? And I wanted to raise this issue because that if you have a very strong political coalition, by the way, I think a lot of these issues are political. And if you have a very strong political coalition, then you can do what you want because that you have that sort of power. But I don't think that we have that. And I think that, you know, we have a former president running for the presidency again, who's running essentially on a foundation of ideas that we probably don't like very well. And might it be valuable for the group to invite in thoughtful people who will give us a better perspective? So for example, in the for the nation's health, I forget the name of the committee, but Martha's committee, we actually invited in people from the Cato Institute, and that I actually found it very useful. You know, we didn't agree with what they had to say, but to understand the logic of their arguments, I think was very, it made a very good contribution to how we thought about the problem. And then the third issue, James, is something that you brought up this morning, and this is something that's really been bothering me, and that is that in order for science and knowledge to advance, you have to have a shared conceptualization. And we've talked a lot about shared conceptualization, but I don't know that we've made much progress on that. And there are ways that that philosophers of science and others have advanced this idea of sort of formal specifications of collaborative thinking. And I do think that we probably need to devote more attention to that, because terms like racism, but well-being and so forth are used in a remarkably heterogeneous way. And as a result of that inability to have a shared conceptualization, I'm not sure that we're moving the ball down the field as well as we should.
Great. Thank you, Robert. So before we go to Martha, no, well, let's go with Martha, then I'm going to potentially shift us a bit.
So Hillary reminded me of the way that Alina and staff put together the findings and how it's important to make the points that you want to see appear in print. And so the thing I want to say, which is a little bit off of where people have been, so I want to come back to the Washington State example and talk about how resonant it was for me to think about bringing people into policy conversations who are not necessarily there. I've done a lot of work in public deliberation, and a lot of the work that I do is around bringing people together who've never been in a room together to talk about their life experiences, and providing that report to decision makers who are willing to be guided by that. I like that example a lot. And I do want to say to the Washington State folks that it really listening to you makes me want to do that in New York. And I know that there are lots of states where that won't be of interest, but I think there are localities and states where there will be of interest and where there can be successes that along the line people will notice, and then perhaps there'll be more.
So thank you for that. Appreciate it. So I'm noodling on a way of thinking about where we go from here, individually and collectively. And so this is a curiosity. I have a curiosity if this is capturing the essence of what you are saying, is that we need an ongoing effort to weave together capacity and connections for the shared movement, for a shared movement, what I'm going to describe as more, better birthdays, which sort of gets at the youth and the, I want my mom to have, like, my mom has decided that when she has a birthday this year, she's going to celebrate the fact that she outlived the other women in her family. Like, that's this year for her. If she makes it, in her mind, if she makes it to late July, then she will have outlived the other women in her family at 70. She makes it to 70. She will have outlived all the other women in her family, right? Her mom, both of her sisters, right? She's going to do that in Hawaii because she's celebrating, right? That's a better birthday. We want her to have more better birthdays. So I want that for my littles. I want it for my mom, like that sandwich generation thing. I see you, I feel you, right? On that. It's real. It is real. So, but I think that's my question. My question is, like, if we can conceptualize the why enough around this generational well-being, and again, one way to put it in language that may be more accessible is more, better birthdays. Are we talking about like some way to weave together, like some ongoing way that would include, some online stuff, some ways to get connected to some of these other opportunities that exist? However, it's to weave it together. It's to make sure that as those individual things happen, there's a way to, I don't know if it's a clearinghouse or a holding space to help weave together the connections, right? Capacity and connections for that shared movement, which we've talked about requires, like, we see opportunities, we know that we're going to need narrative, we understand there's going to be infrastructure pieces along the way, that shared movement for, again, however we want to describe it, I might call it more, better birthdays. Is that the thing we're trying to get at in terms of a takeaway from here? Like that it's that on the weaving, connecting, like some ongoing thing. And that ongoing thing could be, a loose network of people who have committed to one another to do it. Again, some of it may require some money because I heard HTML. Somebody said HTML. HTML is in fact free to understand. It's not necessarily free to turn into a thing, right? So it may require some resources as part of the potentially the capacity piece, but that capacity and connections, is that sort of what we're trying to get at? Or is there a different, not or, and is there a different way to conceptualize it? And is there a different way to think about where we're going? I'm just trying to knit together potentially where we're going so we can land on then what do we want to do? How can we individually and collectively contribute to making that happen?
So I agree with, I think many of us are trying to think of an infrastructure for us to communicate even amongst ourselves in this room. But I also wanted to highlight that it's also a matter of just adjusting personal behavior. So like earlier today when we were in a small group, Ray, you thought about changing the tax code. And then I thought about, okay, that's a great idea and I came up with like ways that young people specifically would benefit from changing the tax code. And then you made the comment about greed and viewing it as a bad thing. And I was like, how do we connect that to how we think about reforming the tax code to be more equitable? So, but these are not conversations that we would normally have. And I think that when we go back to our jobs and day-to-day work in organizations, we just inherently go back to working in silos. And so it's changing our own personal behavior in terms of like, let me reach out to people you may consider random. Like you may not think about young people when you think tax policy, but you should. You know, you may not think about always being inclusive of all of these groups when we're doing the research or drafting, but a part of this is that the infrastructure of communication that we're trying to come up with is only going to work if we're actually willing to change our everyday behavior to mimic that. And then I thought about, and I'm sad that I'm forgetting her name. Sister Simone from Sisters on the Bus. They were at a conference recently and they talked about the 6 elements of advocacy. And so one of them, the first one is social research. And then you have your organizing and partnerships, your social media, your relationships to legislative staff, legislators at any government level of government, legal writing, lawyers, and strategy. And so when you're working on these issues or programs that you're passionate about, have you brought in an equitable manner all of those voices and all of those perspectives? And I think it's just a matter of ourselves being more open, not losing the connections from today, the contacts from this meeting, as we work towards a bigger infrastructure, because again, it's only as well as we actually use it. Because I'm a part of a number of coalitions, and sometimes we get on that call and it's just silence and crickets. And so it's, you know, you have to know how to ask the questions to be inclusive of everyone, and how to actually just take steps forward on that issue that everyone collectively agrees on.
Thank you.
Martha, I love that. You know, that I'm thinking about earlier talking about the platform of the National Academy of Sciences. And I wonder, is it reasonable as a platform, knowing that, you know, somebody said megaphone, shining a light, and we talked about these 2 studies that happened a decade ago, or a series of studies that happened a decade ago. And this reflection that we didn't accomplish what we set out to accomplish. And I heard somebody yesterday say, I don't want to be here in another 10 years talking about the same thing. And so can there be, can the National Academy of Sciences, and maybe this is the plan, I don't know, revisit and put out a new paper and use the power of the pen and your voice and your megaphone to say, you know, we didn't achieve what we were supposed to do. But now we're sitting here and we have all these ideas that are surfacing and maybe a new way to right that ship. I think, you know, like that there are things like tax policy, 100% yes. And you hear people say like, Well, I don't do that. I work in education. Well, if you work in education, you should be paying attention to tax policy. You know, if you care about inequality and its relationship to health and why the United States isn't doing as well compared to our peer nations, it's because of inequality in this country and because of the greed. If you want more data, there's volumes in the library dedicated to those topics, right? So I just wonder, is there an opportunity for the National Academy of Sciences if we're talking about where do we go and how do we, like, maybe we don't have all the answers, you know, but we do know that a lot of the people who have not been a part of the conversation do have answers that haven't been considered. So how do we start to write and use the megaphone to say we got it wrong? Maybe not 100% wrong, but we're not doing what we need to be doing. But we have these pockets of the arc of potentiality, you know, where we need to go. And can the National Academy of Sciences do that?
Absolutely.
So this has been a terrific conversation, and but I always sit in these meetings and listen to the slivers of daylight that undermine the North Star, that don't allow us to speak with real solidarity and urgency because we drift off into other tributaries. And it's not a fault of any, it's what happens in the conversations as people sort of assume their positions. They start to think about, we need to certainly respect diverse perspectives and thought. And this is what challenges people outside of traditional health. It's like, what are you about in health? You have not given a clear message. So one of the things that I worry about, even with the wonderful things that are coming out of the academies, is there is no other thing than this thing, actually. So even though we might want to have studies on healthcare utilization and other aspects of health, if we don't do this, if there's not a single thing, not just from the roundtable, but from the National Academy of Medicine, but from the National Academy of Sciences, then we actually have shot ourselves in the foot, not to be a violent metaphor. And that's the worry that I have. We can then go and operationalize that in myriad ways that are truly community driven, right? How we get to that North Star will differ by culture and history and experience. But every time we let ourselves just a little bit off the hook, we say, well, we have, and it's classic research thing, we have to kind of reimagine, we don't have the evidence, we not, yes, we do. Yes, we do. And that's why I suspect, and I don't want to speak for Martha and Ray and others, I mean, they're up against it when they put those reports out, and then everybody takes their version of the truth from that, as opposed to speaking with one voice. And so I just worry about that. I'm not still hearing the true solidarity, even from this group. And there's just a little bit of just enough difference such that you can kind of drive a truck through it. And so that's a little bit of my worry. I totally applaud where you're going for sure. And the question is, do we actually have the will to centralize this as the thing? Maybe stop doing the other reports. You know, I keep saying, what are we going to stop doing? Maybe stop doing the other reports, actually, in order to do this is the thing. And I know that there are political and cultural and social reasons why we don't. But if we're really being serious, we would do that.
And I just want to make sure we're all clear about the thing, this being the thing. How would you communicate what this is that is the thing?
It is the fact that, you know, during this meeting, we're all aging, right? We're gonna get older for 4 hours from now, right? But we're not aging equitably. This is your better birthplace point. And we can't go on like this. We fundamentally do not have an equation that is going to get us to that thriving, you know, mountaintop. And so it can then boil down to tax code, education policy, and the like, but that is something that we've got to articulate with urgency, with consistency from every corner. And if any sort of daylight happens in the message, then people will take interpretations that then don't serve our ultimate gain. And that's, I think, at least in my, 20 years plus, that's where we've lost our way over and over again because we make the conversation small or we try and sort of deconstruct it or we make it more complicated than it actually is. It's incredibly simple in terms of purpose. It's complicated in terms of how we operationalize for sure, because we have hardened structures, but we've done it to ourselves over and over again. And I just worry, as much as I'm excited about this conversation, that we're just ever so slightly doing it to ourselves again. Maybe I'm alone in that, but that's my worry.
So thank you for elevating that. Did you want to ask a clarifying question?
You said it's incredibly simple in terms of purpose. Could you just state that for me? You said it's incredibly simple in terms of purpose. I just want to.
Yeah, to me,
hear
what's
that.
the purpose of humanity? Whether it's unleashing human potential, whether it's allowing every person to have purpose and dignity. That's fundamentally what life is, right? And so if everything that we're doing, all of our research, all of our investments is not serving that ultimate purpose, then we've lost our way. And that's, I know it's yesterday I said, like, we get into other things. And maybe they're building blocks to that end, but then we overinvest in those other things or the wrong pocket issue. And once you set the table the wrong way, it's really hard to shift, as we know, right? So, and I've not yet heard anybody, and I have to also reflect for my own self, I've not heard anybody say what they're not gonna do anymore. And that's a really hard conversation.
Yeah. So we have some thoughts online, and then we'll come back here into the room. Fisher, what do we have going on?
We got Bobby had something who I think really wanted to build off of what Anita was just saying. So Bobby.
If it's possible to get out of one seat in the virtual world, I would be clapping for Anita's point there. It is the humanity of this, the human-led project of actually trying to thrive in a world where other people are trying to thrive together. That is, to me, also the single unifying focus of all of this work. And a lot of us get trapped in the fragmentation of our various different facets into that work. So I'm with you on this point, Anita. I think if we can really be much more disciplined in the 99% of the effort that we've said multiple times in this symposium needs to go toward building will to act as humanely as possible. It is the inhumanity of the current systems, the technocracy, the bureaucracy, but also the utter inhumanity of it, the racism of it. All of those shades of inhumanity, I think, are the thing that we're trying to build the will to replace with something that is built for equity and well-being by design. And so there are two layers of this. One is the focus attention thing that you just said, but there's also the discipline of communicating in ways that will inspire people to join this work and not sit on the sidelines or worse, be repelled. I'm not even interested in convincing skeptics. I'm much more interested in the exhausted majority of people who are not trying to find new and better ways to be more humane, more interdependent, to thrive together. And that's where I just think we've got two pieces of this. One is the attention and the other is the disciplined communication to be able to lead with things that are going to bring other people to join this work, which may mean giving up the analysis and the strategy and talking about what could and should be to lead with things that actually pull other people in. And I am not an expert in that science. I know Ray spoke to this roundtable isn't composed with that expertise, but we are adjacent to it. We can be learners and practitioners of it. You know, we added Dr. T to the thing, and that's, you know, maybe a step in the right direction. But to me, that's what I'm willing to give up, is the communication that is anything other than built to be inhumane, and communication that's not like hardwired to elicit other people to join, as opposed to featuring some way of talking about it that might actually backfire. And I don't know how to do that. I'm just saying I'm willing to try.
Great. Thank you, Bobby. So where are we? We said we wanted you to walk out of here today with some ideas about where to go and some clarity in terms of how to do that, like how to engage that stuff. And I think either we're there or we're not, or we're sort of close. I'm trying to get a sense of how do we feel like we're doing? Like, are we, Anita and Bobby just said a thing. Does that push us close to where we need to be? Like, what else do we need? What needs to be true for you in order to make sure that we can walk out of here in a way that feels like you delivered on the promise that we walked in here on? Like, what needs to be, what do you need to have? What do you need to get? What needs to be true in our final time together in order to, or maybe to set up what's going to happen after this time together in order to make sure that this has been we've met our objectives for our time together. Maybe you're there. Maybe you're like, oh, this is clearer to me. I understand how I'm going to engage. Or is there a missing piece that you want to make a request about? If that was there, then I'd understand how, what to do.
So I think clearly this was harder than any of us thought it would be when we started doing this, because everyone is still, I think, when we talk about better birthdays or how do we focus on improving the futures of children, because we know that these fights take many years. So we seem to be aware of that. I also just wanted, because I had mentioned to Alina earlier that there is federal framework. Like when I was thinking earlier about Senator Booker's Momnibus bill, Representative Underwood's Momnibus bills, where it's like you have such a large issue like maternal health and Black maternal mortality in this country. And so what they did is they took a set of bills that focus on social determinants of health, from improving nursing and hospital management to also primary care, nutrition, housing, all of the things. But they took those policies, they analyzed them, and they said, these are the ones that we want to be part of this Momnibus. Like they get reviewed and sort of upgraded to the status of being included in this package that has popularity because the name is so it's catchy. There's a clear purpose. And so whenever there is any of those bills move forward, even though they haven't gotten the entire Momnibus to pass, they've gotten a number of victories, the appropriations, and everyone knows, okay, this is a victory for the Momnibus groups. So it sounds to me like we have a kind of a theme of, and then we have different ideas of how to get there, because we're also focused on sort of the different social determinants of health. And I don't think that we're going to come out with saying this is the one solution that we all agreed on. I think we're all just trying to figure out a process and an infrastructure that we agree on, but to still support each other in moving kind of a package of policies together as saying, this is what health 2.0, I don't know what you want to call it, looks like. This is what our Better Birthdays health policy looks like.
Thanks, Jane. I know I skipped you, so.
No, I'm glad the conversation went where it did. So I think building off of that and to Anita's point around sort of focus and maniacal discipline around what matters most. What I'm taking away from these conversations is the need for more disciplined convergence and articulation of what we know works and what community knows works around the frames and the shared narratives and around what we know with regard to capacity for building infrastructure. I think that there is enthusiastic agreement in the need to sharpen infrastructure and messaging and capacity. When we think about what it actually takes to do that, the goal is to build individual and collective capacity for shared action. It is not to create a one-stop hub for solutions, because this field is larger than any single network can encompass. And so it really does, for me, get back to this question of how we are building effective, strong bridges based in trust and transparency and shared aspiration, and really investing in doing that as effectively as we can with an disciplined eye towards that North Star.
Thank you. Anita?
Two thoughts, and I'm just curious where the group is. What would it mean if we just simply worked on two things, right? This may be certainly what Wellbeing in the Nation and other community networked groups are doing. What would it mean if every community in America simply shifted the investment allocations, whether from a policy perspective or the money, to be closer to what actually influences health? What would that actually collectively add up to? Is that possible? How can the Roundtable and its extender networks and others provide the kind of technical assistance, applied support to community-driven solutions that will get every community in America once and for all to actually align with the things that 10 years ago you articulated in the report, right? That's easier said than done. And the second thing is, what would it take for us to have, whether it's vital conditions, a single sort of set of measures or metric that actually spoke to the promise and hope behind health and well-being, and not the deficit behind health and well-being? Those two things, is that possible, is the question I would have for the group. Because I think that then the narrative falls into place, the community networks fall into place, the mobilization around policy fall into place. And we've already said that perhaps the federal moves might be slower than the local community moves. Can we get a saturation in those two spaces across communities? I'm just curious. And maybe there's other solutions, but just trying to, break it down or simplify.
Thank you. Number two, yes. Number one, what about these communities that don't have any resources? I think of the poorest place that I frequent is a town where we have a cottage in upstate New York. Everybody there would say we don't have any resources. What would you say to them?
I think maybe an adaptation to what if every health system in the US chose, at least the ones that are ready to be on this movement, let's just even take the ones that are ready, moved what is currently only 4% of its operating dollars and investing dollars that are being used to support racial justice and act in a restorative way through its own purchasing, hiring, and other anchor strategies, and move that to 33%, with a focus on the places that are most affected by health inequities. And I'm sharing, just offering that tweak, because that's who this group, the Roundtable on Population Health, is wired to address. Public health departments have some resources, and they are doing their own journey using pathways to population health equity and other frameworks to greenline what was redlined. But if we chose together to be part of a wide-scale greenlining effort, we might get to a very different place. And that doesn't need to be new dollars in the healthcare system. It could be taking the dollars we were already going to spend and do that in a way that grows jobs, that are good living wage jobs, that help families, that create career pipelines, and that invests in small businesses in those communities, that really changes what's possible, and that ultimately shifts the balance of power with those communities. I think that would be catalytic.
Martha?
So Anita, when you talk, I get all fired up, and I think it's great. And yet, I think Jane is sort of approaching more of what I'm thinking. Perhaps I'm speaking for you. We have to fire up people and talk about thriving and humanity. And that to me is a grassroots situation. But we also have to have the language that moves politicians. And we have to be able to be comfortable in that language, and knowledge keeps
extending. I mean, we learn new ways to make things better, and we need to examine them. And I understand the challenge of those things potentially, putting a chink, well, we don't quite know yet, so let's not do that. And I think we have to be mindful of that. But I do think that, and I think Martha was saying this too, we need lines of approach, and people have different kinds of skill sets in this room that contribute to the vision that I think everybody's thinking about. But I do like your idea about the communities, and I like the idea of, that thriving notion that we sort of somehow get out to the public and to the policy community and to do better than we're doing.
We're gonna go with Mac, and then we're gonna check in online.
I just had two comments, and I'm loving this idea that the urgent imperative to have that lockstep North Star and message it clearly, consistently, every time, all the time. I personally, I don't know that I'm there yet in terms of what it actually is, right? And like this, we've heard dignity, well-being, birthdays, generations, children, individual children, all of those resonate with me. I don't know that one necessarily resonates above all else for me and for everyone else for always. So I'm not saying that we can't do it. I'm saying we must do that to get that, or we won't succeed at that. And then the other thing to just respond to, one thing that is, I think, going to be tricky if we think about, let's have every city, let's have every community, let's have every state allocate resources in the way that that will improve health. We get into really hard things with braiding funding with a city doesn't control its funding. A city has funding from multiple levels, from multiple funders. I worry about putting too much on any one actor in the system and asking only them, only you have the solution. It feels similar to like a lot of the things that have resonated with me in terms of what Jennifer has been talking about is like a governmental entity coming in and saying to a downstream entity, and Jennifer talked about it as her lived experience as a governmental entity coming to her as an individual person. But I think we could take that same sort of cautionary approach to not say, oh, the city can fix this, the county, the state. It's everybody who's going to have to fix it. So that's why that messaging piece resonates with me so much. And if we already have it and I'm the only person that doesn't get it, totally, just tell me what it is and I will happily get on board, because I love that idea and it's going to take a lot of weight off of my like plate. But otherwise, if I think we could, more discussion there could be helpful for me at least.
All right, we're gonna go online and then we're gonna come back to Dr. T. Do another check-in.
So we have Rami who's online, and just for Anita, your comfort, there have been many tangible stoppings that people are mentioning in online. People online are like, I've already stopped this, or I'm gonna stop that. The stopping is very clear, has been very clear online. So this is Rami. I hope I'm pronouncing that right, Rami.
Yes, you are. Just like the sound of music. Do, re, mi, fa, sol, la, ti, do. Hello, everyone. You'll have to excuse me. I deal with quite a bit of a neuro load and a lot of pain, and I might flip you in the middle finger, but my hands sometimes go in gestures, and I might make a grunt or my noises. I think I'll catch up and catch a little bit of a flow. I'm in Fairbanks, Alaska. I'm just outside of Fairbanks here. And today the EPA is having a full day-long hearing for the community to speak to the quagmire of the circumstances that the EPA and local agencies, local community groups, and local families, residents, local, but then federal, state. In order to make that point, you'll have to bear with me for just a moment. We are here in Alaska, and it's not my North Star. It's not the United States North Star. The flag shows the North Star. But what I've gotten to learn by being a part of the environment that is the North, it it is about that experience of coming to terms with each of us, what that North Star is, and then engaging in those communities and climates to share in that process. And certainly Alaska and the villages, the environment, the trees, the oceans, the salmon, the rivers, they have certainly experienced a lot. And this isn't to get on an environmental soapbox. This is to address the exact same things we've been talking about the last few days. When there are 35,000-year-old baby mammoths just falling out of mining claims and they look like they just died, how to take that in as a scientist, it's hard to distance ourselves using the tools of our disciplines and our degrees, our grants, our travel expenditures, the grant or the field work schedules, to actually take in the speed of the change that's occurring. And so with the National Science Foundation or with the federal government or USDA rural development funds, they're all very great and the money is needed. And there are people like yourselves struggling to come to terms with what the North Star is. And at the same time, villages that are trying to figure out what to do with coastal erosion, and maybe they shouldn't be made into a village again. Maybe they need to be given the resources to have their people throughout the generations decide for themselves what kind of life they want to participate living in what's becoming of what is happening in the North. And it isn't just Alaska that's the North, but Canada, and then the relations with the rest of the world, with China, with the UAE, with the North Pole, the South Pole, the three poles, the Himalayas, and the billions of people that are now facing a very uncertain world. And we in the Americas are not in a vacuum. And so what's happening in Atlanta, what's happening in Austin, or what's happening along the Yukon River, we're all trying to make sense of how to be an auntie or an uncle or a son or a daughter, or maybe a father one day. But where we're at in this work, like we've been experiencing these days, and how we continue these conversations tomorrow, how we feel confused or frustrated or stressed or excited, those feelings are as legitimate as the grant structures or the timing of our degree schedules. And that is what is so confusing for many of you that are locked into, and I use that word not inappropriately, locked into a reality that you have to survive in those cities, in DC and other places where the day-to-day momentum is such that in order to keep your breath, you have to stay in that flow. Well, those structures and that infrastructure, those investments are no longer the most valid. And we're all struggling to figure out how we translate and move through this transition of aging. I'm 51. And my goodness, if we get any more days, we're all very, very fortunate. Thank you for listening. Thank you for all the work. I have been waiting and working for all of this, and however I can be available, I literally am here to do that with you. Thank you for listening and for the time. And whatever happens for this community here with the EPA, with air quality, it's like sipping from a fire hose. And there is no perfect response, and we just have to try to keep taking care of one another as we discover and co-discover what these new structures and relationships will be. Thank you all for your participation. Thank you. Blessings.
Thanks, Rami. Thanks, Rami. And I just want to, there is a little bit online. I think there's quite a few people online who maybe are people in the communities that there's been conversation about, like, oh, how do we reach people in communities? How do we and then examples of, and I think there's a little bit of like, oh, you know what? Many of us online are people that you're trying to reach. And so I think there's a combination of things happening in chat that people would love to be invited to future opportunities. So there's just a lot of expression online of like, hey, please invite us to things. So bring that attention. So we are moving towards a conclusion time. So I'm going to ask us to be brief in our final comments. So I think we'll go Dr. T. No, we'll go here and then Dr. T. Go for it.
I just wanted to applaud Anita's suggestion that we need better focus. And that, there've been a lot of great ideas and a lot of good discussion, but I think it's time perhaps for the roundtable to try to develop some sort of consensus process around what we want to focus attention on, what we're going to give up, and what sorts of metrics we ought to use. And that that I think that would really help move this forward.
So I have a question, and I'm using this question in order to help us move to where we're going to go next. Robert, are you offering to engage the roundtable in that conversation? So I'm trying to shift us from, it would be nice if someone did a thing, to here's a thing that I'm offering to do.
Or I think I hand it off to my friend Ray, but there are consensus building processes. And again, the idea, starting with the discussions of health disparities, maybe 20 years ago and on to social determinants of health, they're always wonderful discussions, but I'm feeling a little bit frustrated that we haven't developed clearer action plans. And I just keep coming back to this issue of, the organization, understanding, and use of knowledge. And that's really been hindered because that we haven't taken the time to develop this sort of common conceptual framework.
Thank you. Dr. T?
Yeah, so just to that point, I think there are some really useful conceptual frameworks. I love the recent work that's been done around thriving together in the vital conditions. I think more energy and effort put behind that could be exactly what we're talking about. So I don't know that we need to create that. I think what's the opportunity here from my vantage point is the energy behind it. There's been a lot of good thinking about not only just the metrics that go into looking at what those vital conditions are, but also the framing behind that, the messaging around that could be really helpful, at least to get us started and kind of moving in that direction. So I want to sort of put a pin there and come back to that. But I also want to just check a couple things, somewhat related to what Ramey just talked about, which is, I think wherever the North Star is, whatever we sort of choose, whatever the framing we choose, has to be broad enough to transcend health. While this conversation is really great, I think somebody said yesterday, the same conversations are happening in all the other sectors, and they're all trying to figure out exactly what we're trying to figure out, but we're doing it separately. The sort of thriving together conversation sort of weave some of that together, that in order to thrive together, you certainly need to have primary care, right? Care and access to it, but you also need decent quality of the environment, right? It doesn't work if you've got great primary care, but the air quality around you is so toxic that you can't breathe, right? Good luck with that. It doesn't work if you don't have a decent place to live and you're in, DC, and you've just recently been kicked out of McPherson Square because you are homeless and you're no longer allowed to just be, right? Because you got no other place to be, right? So one, I think we need to have a framing that transcends health so that other folks who are aligned with us in terms of values also see their stake in our success, and we see our stake in their success. And there is a confluence of our sort of countervailing power against the things that y'all were talking about earlier, which is the greed that we're trying, right? The countervailing power to that. We don't have that if we're so segmented in sectors. And so I just want to put a plug in for that. One, that we already have some frameworks that I think could be really helpful, where there's been some really good messaging and thoughtful work gone into case making. And on top of that, that's a framework that allows us to connect to a lot of other sectors that we desperately need, right, in terms of our work, and they desperately need us.
I'm going to ask you a similar question before I turn it over to Ray. Is that an offer you're making to bring that either conversation into the roundtable or into?
Absolutely.
Okay, great. Thank you.